This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right. Well, I'm Nikola Dragoilovich. I'm the residency program director for the last 2 years. I was a previous resident and then fellow and then faculty, and very happy to continue in my role as residency program director here at UT Health in Houston. So today we'll be sharing a little bit of information about our program, and I'll try to answer as many questions as I think you all will have, so you kind of get to know a little bit about what makes us in UT Health Houston special. If you have not heard of our organization, we are the UT Health Houston is the 9th largest medical school in the States. We're based in the Texas Medical Center. So the Texas Medical Center is home to 3 large academic hospital systems. 3 different medical schools have a footprint in the Texas Medical Center, and UT Health Houston has over 1,500 faculty and over 1,200 residents and fellows in GME programs every year. So a large network of residents and fellows going through training in the Texas Medical Center as a part of UT Houston. And our programs ourselves, we're affiliated with TIER and the Memorial Hermann Hospital System, MD Anderson Cancer Center, and Harris Health. Harris Health is the safety net hospital system for Harris County, which is where Houston is. And we're very proud of our US News and World Report rankings, and our residents and fellows are a big part of why we excel clinically. And one of our missions is to strive every day to bring the best in rehabilitation care to all of our patients. Our residents and fellows are a big part of that, and we hope to have you all join us and be a part of that too. In 2021, UT Health Houston won the Health Professions Higher Education Excellence and Diversity Award for all of their efforts they are making to improve diversity, equity, and inclusion at UT Health Houston campuses. About our department specifically, we were founded in 1993, and now we have over 30 clinical faculty members. We have a separate neurorecovery research center that has its own beautiful building next door to our hospital, with affiliations with Rice University and University of Houston, with lots of research going on and over 5 different projects, over 15 different fully funded grants going on at any given time. It's a fantastic place to walk through and see, and our residents get to be a part of that research if they so choose. The TIER Independent Living Research Utilization Program is a program that helps people with disabilities integrate better in the community and helps advocate for them on a legislative level, not just locally or statewide, but also nationally. That program is run by Lex Frieden. And if you don't know who Lex Frieden is, he is one of the primary architects of the Americans with Disabilities Act. And so his advocacy of people with disabilities is at the core of our mission in our department. We are a categorical 4-year ACGME accredited program, and we've got fellowships in brain injury, spinal cord medicine, and limb loss rehabilitation. So some things that I think set us apart compared to other programs: we have a small class size. We have 4 residents per year. And because we're categorical, that means you do your internship with us based at Memorial Hermann Texas Medical Center and the UT Health Houston Internal Medicine Residency Program. So you get to know your classmates from the beginning, and you've got 4 years. That means 16 residents in total and one-to-one teaching with your faculty. So you start to build close relationships from the beginning. The UT family really is something special. It's why I continue to work for UT Health Houston to this day. why I stayed as a fellow and why I stayed on as faculty, because you have lifelong connections, mentorship, professional resources that will continue to serve you in your professional career moving forward, wherever you are. You'll always be able to call or count on somebody who can help you. There's ample opportunities for research, volunteerism, and advocacy in our program, and our residents definitely make the most of those opportunities. And I think one of the coolest things about our program is that we serve the most complex rehabilitation patients from the Texas Medical Center and from around the world. So I always say, if you can take care of patients in our program, you can take care of patients anywhere. Our leadership starts with our chair, Dr. George Francisco, who is very accessible and approachable. I remember as a resident in our program, Dr. Francisco called me and asked me how my day went. And when I saw his phone number flash across my phone, I obviously panicked, freaked out, started sweating. But obviously he was very reassuring and checking in all of us. And I think that sort of sets the ethos for what our department is like. We try really hard to cultivate close relationships with all of our residents and fellows, from Dr. Frontera, our Vice Chair of Education, myself, Dr. Joseph, our Assistant Program Director, and our Coordinator, Kathy Brown. We try really hard to give everyone what they need and then some, and be in contact with you all and really advocate for you in every way possible. That UT family has meant a lot to me as a resident and fellow and team member, and I'm really glad to continue to cultivate that as a program director. I like to share these photos of residents with our faculty and our coordinators, because it gets at a little bit about who we are. And you will spend the next 3 or 4 years in residency training with the people around you, and you want to make sure that it's a group of people who supports you in every way, shape, or form. And that's what we try to do. Yeah. Our home is the Texas Medical Center. It's a huge complex of medical facilities. On its own, it would be the 8th largest business in the United States. Over 1,000 hospital beds are available at any given time, over 8 million patient visits a year. Over 30,000 babies were born there last year. It's an incredible place to be. It's vibrant. There's lots of collaboration across the hospital system. So to train here is a lot of fun. Some highlights about our curriculum. We have a protected Thursday morning lecture series and grand rounds. All residents are required to attend, and the speakers there are from the residency programs from us, as well as the Baylor College of Medicine PM&R program. We have a monthly grand rounds with a really broad, diverse speaker set. You can hop onto our program's website and check out some of the grand rounds we've had over the last few years. I update that list very regularly, or at least try to. Our William H. Donovan Critical Review of the Literature is a program where, as a PGY2, you learn how to appraise journal articles, and learn how to develop a research question, and learn how to research that question, and how to appraise research. How is that going to help my patient population? Is this a good quality study or not? What am I looking for? And then that culminates in a presentation that you do on a clinical question. So that's always a lot of fun to learn how to be a good user of scientific literature. And we hold lots of regular workshops on the physical exam, spasticity, ultrasound, all the good interventional stuff. And then we have some great additional programs through McGovern Medical School. They have a physician certificate program, which is an 8-month-long program that allows residents or fellows to get additional training and teaching. And that's a very popular program with our residents, because we get a lot of medical students come through our department, and so you have the ability to practice teaching a lot, and that we expect our residents to do. The certificate in healthcare management through McGovern Medical School and the University of Houston is sort of like a mini healthcare MBA. That one is supported graciously through the McGovern Medical School and the University of Houston, making it a very, very low-cost way to get an excellent education in sort of the business side of medicine. Dedicated quality improvement curriculum, where you're paired up as PGY2s with PGY3s and 4s to either answer clinical questions or do any type of project that will help out the residency program or the experience in some way. So you get to act out the PDSA cycle in real life, and lots of our department offer a model board review course. In addition to that, we'll obviously throw in a bunch of perks. We help you, we'll pay for your membership to the large societies. We get you the board prep Q bank. We have you attend the Kessler board review course as a senior. You get a yearly $250 book stipend, and we support your travel to conferences and attendance. So we're generally very supportive of our residents going out there and enjoying conferences and having the opportunities to present their work. So touching on our rotation schedule, you'll see the internship is shaped by us to not be a typical internal medicine year. Yes, you have some wards months and you have a MICU month, but we really try to round it out with experiences that are very physiatry related, like neurology, a geriatric service, a cardiology service. You get 1 month of PM&R, and then you get to transition those skills into your PGY2, PGY3, and 4 years. You can see that we do offer more of our inpatient months in the beginning to try to make room for pain, musculoskeletal, cancer rehabilitation, your business courses, and pediatric experiences later as a PGY3 and PGY4. However, the way our program is set up, we do offer flexibility. So increasingly, we have been moving those inpatient months to PGY3 or PGY4, so you can continue to build those skills as you go throughout your training, and then offer more flexibility in terms of getting you earlier pain or sports exposure for people interested in those fellowships where early exposure and getting letters is really important. TR Memorial Hermann is our primary inpatient rotation site. We also have a very busy outpatient service there. And so you'll do clinics there, spasticity management, joint injections. Memorial Hermann is the level 1 trauma center we're affiliated with. That's where your internship is going to be. It's the largest level 1 trauma center in the country. So to say you will see 30 of everything is an understatement. Lots of volume, lots of things to see, lots of ways to learn. Children's Memorial Hermann is our one of our pediatric sites. There's also a pediatric inpatient rehabilitation unit at TIR that are staffed by our pediatric physiatrists and our hospitalists. So great ways to shore up your pediatric rehabilitation skills. You'll get cancer and pain at MD Anderson Cancer Center, as well as 2 of our private practice affiliations, which is Psy Pain and Spine, which is a private practice by Brian Bruell. He's very well known in the world of pain medicine and physiatry resident education. So you'll be working directly with him in his busy clinical practice. And then the Human Performance Center, which is the private practice of Anka. So you'll get time with him learning his approach to sports medicine, ultrasound for diagnostic and injections. So, pain in sports has been growing very steadily in our program over the last 5 years, something that we're very proud of and something that I think will continue to grow in years to come. And then your affiliations with the Harris Health System is primarily through consult rotations in the Harris Health County Hospital, helping patients get to rehab, figuring out what DME or other rehabilitation services could be provided, and also their EMG clinic, and a joint ortho PM&R clinic where PM&R and ortho work side by side to treat patients with musculoskeletal conditions. So just looking at where our graduates go, you'll see as you look through the classes over the last years, a mix of private practice, brain injury, spinal cord fellowships, pain fellowships, sports fellowships as well, cancer rehabilitation. So whatever you're interested in, we will get you there. And I will bend over backwards to help you get to what you need and wherever you want. That's my big task as a residency program director, and I'm up to the challenge. In terms of procedural counts, you'll see that our classes have no problems meeting ACGME required minimums. And, I tell people with respect to procedures, it's not about getting the minimum number. It's, can you do them when you graduate from residency? And thankfully, we don't have any issues with our graduates getting all the experiences that they need in terms of peripheral joint injections, botulinum toxins, plenty of spinal procedures and electrodiagnostics to make sure that you are ready to do whatever it is that you have set your heart on. If you all have any questions that we don't get around to answering here in the meeting, please don't hesitate to find us on Insta and Twitter. We have our website as well. That's a great resource. We've got additional information about our residency program, and our video from PM&R Scholars last year is up there where we go into our program a little more in depth. So feel free to check those out. You can also contact our program coordinator, Kathy Brown, via email or phone. You can also find me on Twitter, so at Dr. Nico Drago DO. So if you find me on there, don't hesitate to ask any questions. Okay, so I see, it looks like Stephen Johnson from Dartmouth is asking, is there a preference for folks coming from Texas? How much time do folks spend commuting? We definitely do not have a Texas preference. We enjoy recruiting, residents from Texas, but, I'm from California. We have, in the most recent class, we have 2 from Texas, 1 from North Carolina, 1 from Puerto Rico, 1 from Belgium. We have previous residents from China and all over the Northeast. So we don't necessarily have a Texas preference now. We're looking for bright and hardworking residents. And if you happen to be from Texas, fantastic. But you don't have to be from Texas to fit in. Houston is very much a melting pot. It is the most diverse city in the United States. I'm originally from California. Like, I grew up surfing and eating burritos, and I found Houston to be a really nice place to live. And I really think it offers something for some residents are able to buy homes in Houston, though I will say that the Houston housing market is not as affordable as it used to be. I think sort of the word's gotten out, and like a lot of other real estate in Texas, it's not as affordable as it once was. But that being said, some residents have done that, and they have chosen to buy property as opposed to renting. A fair amount of residents are married or have families with kids. I would say half of residents in a given class typically have children, and we're very supportive of families. We have a very generous leave policy, and we work really closely with our residents to make sure that they get everything they need in terms of scheduling and accommodations for family life. That's a big part of who you are when you come here, and we don't want that to suffer in any way. Ann Dow from MSUConn said, can you tell us more about the international rehabilitation program? Sure. I think what comes to mind is probably the patient population that we have at TIER. So TIER, being in the Texas Medical Center, we get a lot of patients from all who come for their rehab. That might be from somewhere in the Middle East, or somewhere from, Central or South, or people who have done rehabilitation at other hospitals in the United States, and then they come to TIER for additional rehabilitation or sort of a new perspective on their rehabilitation. So we do have a large international rehabilitation presence at TIER. We dedicated international program with dedicated faculty. I'm part of that. It's something that TIER has been building for the better part of 20 years. It's a really interesting challenge, and it's something I think is a lot of our residents do rotate and work with those patients. And so we that's possible by having international liaisons that help communicate with the country's embassies or the family members in their native languages, and translators around regularly, so that communication is easy and smooth, and lots of other supports for the patients and their families to make their stay in the United States and their rehabilitation course go well. And sometimes those patients are discharging back to their original countries. So that means, getting on a flight or getting an air ambulance, and coordinating those types of discharges is definitely an awesome learning experience as a resident. That's something that you will see every day, but a really cool thing to be a part of in terms of learning and really being able to offer something that to someone that is not available in their home country. Hopefully that answers your question. Munib Zaidi, I apologize in advance for any mispronunciation. What do we look for in US IMG applicants specifically that could help them stand out? I think more than anything, we are looking for residents, whether they're IMGs or not, who have a desire to, make our program strong in their own way. What will you bring in terms of your personality or clinical skill set, or advocacy or volunteerism or whatever it may be, that will help not only you flourish as you get your residency training done, but also help serve our patients. And so, we're not looking for a minimum step score. We're not looking for people from a certain part of the world. We really are very open to IMGs applying to our program. We have a history of taking IMGs in our program who have become phenomenal physicians, and some have stayed in the United States and some have gone back to their countries and brought those skills back to their home. And so, for us, it's not really about the numbers. For us, it's really about what are your interests in physiatry? How does that meld with what we have to offer? Do we think that you would be successful with us, and can we make you the physician that you want to be? I think those types of things matter more in your application than anything else.
All right. Thank you so much, Dr. Dragojlovic, for the presentation. It was very lovely.